Sleep is something we all need every day. But sleep is not only about rest. Sleep is also closely connected to brain health. Many people notice changes in sleep as they get older. Some people sleep less, some people sleep more. Some people have troubles falling asleep or staying asleep. This often leads to an important questions. Can sleep be linked to memory problems or dementia? Today we will talk about what research tells us about sleep and dementia. The information shared here is based on a peer-reviewed research paper published in 2024. The study reviewed many long-term studies from different countries to understand how sleep duration is related to dementia risk. Dementia is a condition that affects memory, thinking, and daily life. Alzheimer's disease is the most common type of dementia. Dementia usually develops slowly over many years. Changes in the brain often begin long before clear symptoms appear. This is why early signs, including sleep changes, are important to notice. Sleep plays an important role in how the brain works. During sleep, the brain rests and repairs itself. Sleep helps the brain clear waste products. Sleep also supports memory, learning, and emotional balance. Most adults need around 7 to 8 hours of sleep each night. As people age, sleep patterns often change. Sleep may become lighter. People may wake up more often at night. These changes are common with aging. However, very short sleep or very long sleep may be linked to health concerns. This research paper focused on sleep duration. The researcher compared three groups: people who slept a short amount of time, people who slept a typical amount of time, and people who slept a long amount of time. Short sleep was usually defined as 6 hours or less per night. Long sleep was defined as 9 hours or more per night. The researcher reviewed more than 30 large studies. Together, this study followed over 1 million adults. Some people were followed for a few years, others were followed for more than 10 years. This helped researchers understand long-term patterns, not just short-term changes. First, let's talk about short sleep. In studies that follow people for a shorter period of time, those who slept very little were more likely to be diagnosed with dementia later. However, in studies that followed people for a longer time, short sleep was not linked to a higher risk of dementia. This finding is important. It suggests that short sleep may not cause dementia. Instead, sleeping less may sometimes happen because the brain is already changing. In simple terms, short sleep can be an early sign rather than a cause. Now, let's talk about long sleep. The research found that people who slept 9 hours or more each night had a higher risk of developing dementia. This finding was seen in both short-term and long-term studies. This suggested that long sleep may be more strongly linked to dementia risk. Researchers believe long sleep may be related to other health issues. This may include depression, low physical activity, inflammation, or changes in the brain. Long sleep may also reflect lower energy or reduced daily engagement. Sleeping longer does not mean someone will develop dementia, but it may signal that something else is affecting overall health or brain function. The study also looked at how long it takes to fall asleep. This is called sleep onset time. People who regularly took a long time to fall asleep had a higher risk of dementia. This does not mean that occasional trouble sleeping is harmful. Many people have poor sleep from time to time. What matters is long-term sleep difficulty that continues over time. Researchers believe sleep problem may affect dementia risk in several ways. Poor sleep may increase inflammation in the body. It may affect blood flow to the brain. It may reduce physical activity and social interactions. It may also affect the heart health, which is closely linked to brain health. Sleep is also important for clearing harmful proteins from the brain. When sleep is poor, this cleaning process may not work as well. It is important to talk honestly about the limits of this research. Many studies rely on people reporting their own sleep habits. Sleep was not always measured using medical devices. Other health conditions were not always fully controlled. Because of this, these results are helpful but not perfect. More research is still needed. This research does not mean that poor sleep causes dementia. It does not mean that sleeping longer will always lead to dementia. It does not mean people should panic about sleep. What it does mean is that sleep patterns can be important signals. Changes in sleep should not be ignored, especially if they last a long time. If sleep changes are new, severe, or concerning, it is important to speak with a healthcare provider. There are gentle habits that may support better sleep. Going to bed at the same time each night can help. Waking up at a regular time can help. Getting daylight during the day supports the sleep cycle. Staying physically active during the day can improve sleep quality. Keeping the bedroom quiet, dark, and calm may also help. Sleep needs are different for each person. What matters most is noticing changes over time. For caregivers, sleep problems can be especially challenging. Night waking, restlessness, or long sleep can affect the whole household. Feeling tired or stressed is normal. You are not doing anything wrong. Support matters. Rest matters. Asking for help matters. To summarize, this large research study suggests that very short sleep may sometimes be an early sign of dementia. Long sleep may be linked to a high risk of dementia. Sleep health is an important part of the brain health. Paying attention to sleep patterns can help guide conversations with healthcare providers. Small observations can make a meaningful differences. This video is for educational purpose only and does not replace medical advice. If you have concern about sleep or memory, please speak with a qualified healthcare provider. Thank you for taking the time to listen.